Hi, I'm Dr. Keldon, and in this video, you're going to learn how to treat your knee pain and osteoarthritis at home with simple and easy exercises. Exercises that really work. Besides these exercises, I'm going to give you a bunch of tips that can help you with treating knee osteoarthritis. Tips that probably no one has explained to you before. Your knee looks more or less like this on the inside, or at least one day he was like that. It's made up of 3 bones, the femur, the tibia, and the patella, which are connected by several ligaments. All this white part you're seeing in the video is the cartilage. That protects the knee so the bones don't hit each other during movement. That is, for the movement. Happens much more smoothly, without you feeling pain. These structures in the knee, and many others, are nourished and lubricated by a fluid inside your joint. Remember this name well. We call it synovial fluid. Basically, this fluid is the body's natural lubricant. It's released in greater amounts in our joints, precisely when we move during exercise. And the vast majority of the causes of these painful symptoms in the knee is exactly this: the lack of lubrication, the lack of synovial fluid, muscle weakness in the muscles that protect my knee, and also muscle shortening in the muscles around the knee. And that's why some very relevant scientific studies actually show that exercise is one of the best treatments for osteoarthritis, not just in the knee, because exercise helps address all of these causes for knee pain. But coming back to what's happening inside your knee, pay attention. From the moment osteoarthritis develops, things change. You start to feel pain and discomfort in the knee joint. The cartilage itself starts to wear down, and that's when your knee is really asking for attention. And in a more severe stage of osteoarthritis, the person starts to notice swelling in the knee, a significant loss of flexibility during movement, on top of all those symptoms I already mentioned to you. All of this happens because the cartilage gets more worn out, reducing the joint space inside the knee. There are osteophytes, which are bone growths. Bone starts to rub against bone because that cartilage that used to protect is degenerating. Everything turns into a mess. But don't worry, I like to tell my patients, osteoarthritis isn't always a disease, but in most cases, osteoarthritis is simply a result of the body's natural aging process. Think about it. If you drive your car for a long time, the tires on that car will wear out. And it's the same thing with our bodies. It's a result of the body's natural aging process. I hope I make it to 80 years old, and I know I'll have osteoarthritis too, but it's a natural process, and there is treatment. There are ways to reduce these symptoms. And yes, it's possible to have healthy knees. And these exercises you're about to learn are exactly for that. So let's get right to it. With the first exercise number 1. For the first exercise, you can sit on a chair that feels safe for you. And you're going to do the following. On your heel, lifting the tip of your foot. Now make a windshield wiper motion with your feet. So rotate your foot from side to side, putting extra emphasis on the inward movement for 10 repetitions. And remember to always do the exercise with both legs so the other one doesn't get jealous. Sometimes the other one starts to hurt because you're not exercising it. So remember you have 2 legs, 2 knees, not just one. And this exercise is meant to work on the mobility of the menisci, which are 2 little cushions inside your knee. These menisci help improve shock absorption and distribution in your knees, ensuring better gliding in the joint during movement. If you do this exercise, you'll already start to stimulate the production of that synovial fluid I mentioned to you before, which is the natural lubricant for your joint. Exercise number 2 for the second exercise. Still sitting in the chair, do this movement of straightening your knee. So stretch it out slowly and also return slowly. Count 10 repetitions first for one leg, and then another 10 repetitions for the other leg. If this exercise gets too easy, add some weight to your ankles, like an ankle weight, for example. And if you feel pain either with or without the ankle weight, you don't need to fully straighten your knee. Just go halfway to about 45 degrees of knee extension. This way, you'll have a protective angle to do this exercise, which will greatly improve your pain and your knee osteoarthritis. This video was inspired by the comments that you're seeing on the screen. Leave your comment too. I read all of them, and besides that, your comment has a great chance of appearing in a future video. Don't forget to give a thumbs up, subscribe to the channel, and turn on the notification bell so you can receive all my videos and tips here on YouTube from now on. Exercise number 3. This is another exercise that brings almost instant relief to knee pain. Remember that little triangular bone in front of your knee that I mentioned at the beginning of the video? We call it the patella. In this exercise, we're going to mobilize the patella. For this, you should sit down and stretch out your legs. Put your 2 thumbs together just like I'm showing here in the video and place your thumbs on the upper and outer edge of your patella. and press, sliding the patella downward at a diagonal angle. You can repeat this movement 10 times, and then push in the opposite direction. Now, from the middle down, also at a diagonal, just like I'm demonstrating here in the video. Another option is to move it outward, meaning place both fingers on the edge of the middle of the patella and press outward, also for 10 repetitions. And finally, place one thumb on top of the other and push your patella from top to bottom. So let's go from top to bottom. A lot of people have what's called a high patella, meaning the patella is positioned higher than it should be in terms of anatomy. So this is a great exercise to help relieve your knee pain. Exercise number 4. For this exercise, you can sit on one chair and use another for support. You need to make sure that neither chair will slip. You need to make sure you have this safety before starting the exercise. Pay attention. Another option is to sit in front of your window and hold onto the base of the window track, which also works really well. All you need to do is stand up and sit down very slowly, doing the movement in a controlled way for 3 sets of 10 repetitions. This is a homemade squat to strengthen the muscles around the knee and help relieve osteoarthritis pain. If you feel severe pain while doing this exercise, you don't need to squat all the way down to sit on the chair. You can squat to about halfway, or a little more than halfway. You can reduce the range of motion, and then, later on, you'll gradually increase that range as you try. Eventually, you'll be able to bring your hips all the way down to the chair. But at first, you can do it the way I told you if you feel pain, because it's better to do an exercise with less range of motion than to do nothing at all. Many patients I see at the clinic mention their knees crack when doing this exercise. So let me know in the comments if you're also one of those crunchy people, the kind of person who cracks all the time, because I'm curious to read your comment. Exercise number 5. For this exercise, I'm going to show you how to treat your knee through your hip. What do I mean by that? It might seem like one joint has nothing to do with the other since they're so far apart. But today, there's a lot of reliable scientific evidence showing us that weakness in the hip muscles, especially the gluteus medius muscle, is linked to knee pain. That's because if your hip muscles are weak, your knee can end up misaligned, like in a dynamic valgus or a varus, for example, some postural changes. So we use the hip muscles to treat the knee because the hip plays a very important biomechanical role in aligning your knee. I like to joke the knee goes along with the crowd. So if there's a deficit in your ankle, foot, or hip, the knee will follow along too. And then the knee might start to bother you, not just because of the knee itself, but also because of some secondary joint. So for this exercise, you're going to lie on your side and preferably use a resistance band around your knees. Why do I say preferably with a resistance band? Because if you don't have a resistance band at home, you can still do it the same way. The band just helps create some tension to strengthen your hip. But it's better to do it without the band than not do it at all. Now you're going to press one heel against the other and rotate your knee outward and backward, doing 3 sets of 10 reps for each leg. Actually, in this movement you're doing, the ones moving your knee, pulling your leg outward, are your hip muscles. That's why I said we would treat the knee by moving the hip. So we shouldn't just think about the knee, but about the whole body. Exercise number 6. Last but not least, we're going to do a stretch for the muscles at the back of your thighs. For example, we call them the hamstrings and the calf muscles. We call the calf muscles the triceps surae. These muscles are part of a facial line, which we call the posterior chain. And when this chain is shortened, it can be a major culprit for your knee pain. For this exercise, you're going to lie down. You should have a belt, a rope, or a resistance band, and you should hook whatever you have available at home onto your feet. Now grab your strap. Pull your leg up with your heel pointing toward the ceiling and your big toe pointing toward the tip of your nose, trying to increase your range of motion, but without bending your knees. It's normal to feel pain in the back of your thigh or behind your calf, since that muscle is being stretched. So do this stretch for 3 sets of 40 seconds on each leg. I hope I helped you with these exercises, and as promised, here are some tips about questions that you all have sent here in the comments. I'm answering them now, as well as some frequently asked questions I notice from my patients. In the office, for example, some people asked me, "Doctor, is aerobic exercise important for those who have knee pain? What exercise should I do? I do a treadmill, I do a walk outside, I do a bike." And I always tell these patients that the best aerobic exercise, besides the exercises I just showed you and some others, really depends on the patient's evaluation. But the best aerobic exercise I recommend is cycling with a bit of resistance, so the knee doesn't just move aimlessly on the bike. So with a little resistance, this already helps strengthen and improve the range of motion. and it's the best aerobic exercise for those who have knee pain, for those with osteoarthritis, and for those who want to strengthen their thigh muscles. Another very interesting component for knee osteoarthritis is actually heat itself. There are rare exceptions where there is joint swelling involved, where a clinical prescription for a cold compress ice or some other alternative is used to try to get that fluid out of the knee. But most time the ideal treatment for osteoarthritis is always warm compresses, heat therapy. That's where, if needed, hydrotherapy comes in, usually in a pool, and the water for hydrotherapy should be heated to 33 degrees Celsius, so that heat helps you do exercises in the water. And it also helps because the water takes some of your body weight off, giving you the feeling that you're lighter, which allows you to work on the exercises with less impact and less strain on your knee. So it's a very interesting component to do these exercises in hydrotherapy or even using a hot water compress. And if the compress doesn't make your pain worse, that's the right way to go. Keep doing it. And since we're talking about osteoarthritis, this issue of weight, taking the weight off your body in the water is good. The opposite is bad. The more weight. Today, scientific evidence shows us that the more overweight a person is, the worse it is for osteoarthritis, because there's more strain on the knee. So be careful. Weight is a very important factor, but it's often overlooked by many healthcare professionals. But I always emphasize this point with my patients. That's why referring these patients to a nutritionist is very important for dietary re-education, to try to lose weight, to try to remove from the diet those foods that are inflammation boosters. They make osteoarthritis worse, like processed foods such as, and I've made a video here on the channel that can already help you with this topic, so you can understand that there are some foods that are inflammation boosters. They worsen inflammation, worsen osteoarthritis, and increase pain in the body. There are other types of foods that actually reduce inflammation. Maybe you're eating these inflammation boosters at home. So if you want to find out what they are, click on this video here to watch. And don't forget to leave your like and subscribe to the channel. I'll see you there.